Everybody tryna be something, yeah.
When the airwaves in your market become more and more crowded, it's time to break it open and really stand out. Broken Air is here.
On Mainland 98.3 FM, the sound of Lagos. Lagos.
Bring you Health Plus to remind you to take care of your health. Good morning. Today we're talking about menstruation. My name is Lillian and I have a guest in the studio. Menstruation is a normal and healthy part of life for most women. Roughly half of the female population, around 26% of the global population, are of reproductive age, and most women menstruate each month for about 2 to 7 days. Yet, as normal as it is, menstruation is stigmatized around the world. A lack of information about menstruation can lead to damaging misconceptions and discrimination, and can cause girls to miss out on normal childhood experiences and activities. Many don't even know what to do when they are menstruating. Poor menstrual hygiene can pose physical health risks and has been linked to reproductive and urinary tract infections. Now, accompanying aka dysmenorrhea. Dysmenorrhea is with morbidities that affect quality and many other about managing menstrual cramps, and we'll talk to you, also walk you through some ways to practice menstrual hygiene. Of course, I'm not alone in the studio. I have Dr. Perfecta Osawa, and registered alternative medicine practitioner. Sawaru in the studio with me. Good morning, doctor.
Good morning, Lillian.
I know that today's topic is about menstruation.
Okay, so when you start with what menstrual cramps are, there's a need to understand that there's a premenstrual syndrome that happens before the menstrual cramps, like before the proper period pain that people go through. So the period. So many ladies complain of this, and then it could range from them being cranky, having emotional trauma, but then the menstrual cramp itself is a throbbing pain. It could be fixated, but in the lower abdomen of the stomach. It could also move down to the back region, because most people also complain of that. Also, it can also affect the legs. So there's this part of the leg that many ladies also complain that they experience severe.
Any other thing that can cause you talked about, I know that, is there anything that affects it just because they want to see their period?
Oh yes, so it'd be vomiting and all of that, and that's why it's essential for them to understand that in turn plays in the way they experience period pains.
Just then you jot it down in case you see it again, and you know that this is normal. Sometimes my body hospital.
Okay, so they understand that, oh, I'm ovulating now.
Yeah.
Then they'll know that, oh, this pain that is coming with this ovulation, their cycle, they know that, oh, at day 14, or if their ovulation is day whatever, day 12, stomach is always at the
okay. So I know I just asked this question now. Why do you think some people have
experience it while others don't? But then again, it's also rooted in the way, but it doesn't mean that our body is the same thing. There's no one fit size approach for this thing. So the pain, so it's normal, it's not normal for you to experience period pain, but it's almost
a higher threshold for pain, and they might
if what I'm saying, when you have like a very slight discomfort, maybe like, oh, you know that this is my level.
How do we even know the scale of 1 to, I hear this a lot. Okay. So how do we even know the scale?
Right, from the onset of your period. Some people are worse. So for someone like that, you'll be able to it will be like persons that started with period pain, like from explain all of this while you consult, you can tell that, oh, this is what this person's pain level is like.
Okay. So what then causes painful menstrual cramps? Because you just said it. Then they were like, are you sure you're not? What's the root cause of painful menstrual cramps?
Okay, so like yet again it could differ. Consuming so much dairy products and consuming so much cold and raw food. Really, raw foods could be you're eating healthy, but you're taking cucumbers, watermelon, this, that. Their food thermal nature. If I say ginger, what do you think it is? Do you think it's hot or cold?
Hot.
Right, cucumber and all that. I'm saying their thermal nature. I'm not saying their room temperature stuff. So now you're taking cold things, and I like to use this example a lot. If you're in a traffic situation and then there's this, what do you call, just use flow freely. Oh my gosh. Right?
That is another thing I will talk to you.
You're creating that stagnation, and everything you're using nation by yourself.
Okay, when you have to use the loo, raw and cold foods, right? You're saying it's high in fiber, and a lot of people require their fiber daily. So if I'm a
typical Nigerian, keeps it in the fridge, so it's already a food. The thermal nature of that food is already raw. Plus you're taking, so it's not like it's just one thing, boom. So now everybody has to find out what their trigger is. Some people will say, well, she asked her mom to always reserve the fattiest meat. I think there's any English like
really?
that. That things that causes this whole menstrual cramp thing. So to your routine at all. So you just need to know this person understand what works. So like me, when I take something, it's not just to look at the pain as if it's one thing they have to client doesn't like.
Yeah.
And she start checking. Did the cake get burnt in the oven? Did this, did that off? Now most ladies are always focused on the pain. What can I do to at this period? I said when you're that's the time that you want to nutrient, like it's your you need to give into sugary things more.
Hearing from God, right? And I don't know what if I'm seeing ice cream or I'm thinking about ice cream, me that my body's not telling me that it's ice cream I should take. It's telling me something
in life. You need to ask the question of how.
That's
because over time you've at this point I'm like liable to be cranky if the stagnation with the digestion can standing their body, understand your body saying I want to bleed now. They're like, no, this is the time that I want
Health Plus, and we are shedding a lot somebody. But any questions concerning your cycle, concerning your body as 04? We talked about understanding the root cause, just like right, because to pop up somewhere else.
Yes, exactly.
Right, so that's what you're saying.
But you should not wait for the period cramps to happen before you now start looking for. When the period cramps come, you will first have to endure it. I know that you'd have to wait for it to do the right thing before the period comes, so that when the period, and again there are different period pain types actually, so if you're not
so that still goes for preventing menstrual cramps. It's ovulation pain, like we have pains for everything. so okay, even should one be quick to raise an alarm when one notices a need of my flow and I'm having pains, right? And I'm saying that this pain white tackle water is not there, right? So that's how we work. If I now notice something wrong with me while I'm having my period, and I've not seen.
The question to that is yes. You should, whenever you notice something, because then again, vital signs are like so it means that whatever is going on in your period, if you can just take your period, right? So when you see that kind of thing, that your body's trying to communicate with you that this month, so if raising an alarm at that point in time will just save you from
in the world, I'm not talking about Africa or Nigeria alone.
Okay.
In the ignorantly treats the symptoms instead of the root cause.
Okay. When I started asking her questions, it dated back to when she was 14. Maybe she told her parents, or they checked and said, what's the word now? It wouldn't have gotten so bad at 30, right? Just something that like a symptom that just surfaced, and I'm like, okay, what's this serious health issue later? So when you neglect something, it would now start showing as other questions. What is this? Why is that? And all of that. And I'm like, oh, so you mean from that
teenagers, whenever one has their periods, some have it late, some have it very early. As a mother, I've gone through this. You literally know what it's about. It's not like as a kid, but then your daughter is going through it, and you're not even taking her through anything. You're not providing her the basic amenities or necessary. Child gets their menstruation. What should parents? Who is present when their child
menstruates, except women? As in, we keep this thing. So you get close to her, and then you start educating her and stuff. And this thing you're talking
tackled, yes. That's true. Not just
So it was just like, oh, use this, use that. So for me, I would say that I have knowledge down to their younger ones. So they should seek ways to be informed so that they can inform them and now start, passing that knowledge on to them.
I think mothers of this century or they know about this, but they don't have the time to know how to use a sanitary towel or pad or tampon or whatever it is they use. The do's and don'ts during menstruation, because when we talk about hygiene, we're talking about how to treat yourself and take care of yourself properly during menstruation, and don'ts during menstruation.
Okay, so I like to start with the sanitary towel, brain reactions, and then they have to first deal with itchy blah blah blah. Then they now have their period on top of it, and that is suitable for you, and then stick to it. So don't do peradventure is like you don't bleed so much.
So you should never use it again.
Yes, so you should so I like you don't feel. So for that kind of person might be consuming more sanitary towels, and it's not from a place of I bleed heavily or one. Then right, dispose it in this place. And then there's the way you wrap this thing.
When I got to our house, I saw it.
Okay.
So it didn't ike me, but imagine I was
so I think we all know that vagina is clean, right? So using of some product, some like what they call it, scented soaps and all of
gouching, what they call that thing, is it louching, be gouching, or what they call it,
like
douching, right? So why do people do that? They say that if you put it into wash, it's not pot. These are people sell yanni pearls and all that thing. They'll tell you that if you put it aside to wash it, but then you are saying that it is self-cleaning, right?
Okay, so now let me explain that. So it's not like you don't want to clean the most, but like you say, yes.
Can you wash it with a soap?
You can actually clean it,
with soap, because I heard you use only water.
What? Okay, let me say, because some people now selective hearing like that. So let's be guided. Just clean with water, right?
But very carefully and thoroughly. All right. And then what about food?
There's something one of my mentors used to say. She's Chinese though. She says that you cannot grow a baby in a fridge.
Okay.
You cannot grow a baby in a fridge. Even if someone gives us a premature baby, they have to put baby in an incubator. So all that, everything that is going down, they just want warmth.
Okay.
So if you can, find ways to introduce warmth, I don't just mean be consuming overly. And that would be like too much bleeding, right?
Yeah.
So what I'm saying is that you have to. This thing is moderation, right? When they say prioritize warmth or movement, it's also movement. You can aim to exercise daily. You can aim to take warmth things. Then again, understand your cycle. So there's a phase in your cycle where you should prioritize warmth the most, right? That's post ovulation till your period. So you know that throughout that period, that's not the time that you want to indulge in anything. So
and with this AC,
yes. Now exactly. Thank you for bringing that up. This whole warmth thing again. Some people, I know that this is modern society and they want to stay in office that has AC, car AC, this, that. One of the easiest thing that can ever or wrongly happen to your man is have this cold in the uterus thing, and it can go through anyway, even like beneath like under your foot. So you walk barefooted, so cold.
I can't do that.
You get to walk barefooted, you stay in AC office.
So cold can go into the uterus.
Yes, actually the reproductive organ, like from beneath your foot. Yes, like that can actually cause a cold in the uterus thing. So all of those measures, you want to just start checking that and putting them in place.
Okay, so if it's compulsory for you to have ACs in your house, in your car, in your office, in your car, at least in your house, just
tone it down
and stop working many times. And I'm wondering, what does it mean? Free flow. Some people say they like free flow. Some people like tampons, some people like towels, some use pads, but some say they like free flow. What does that mean? And is it healthy?
That's not using any menstrual product at all. They just stay and then allow it to just flow
in their bed. I don't understand.
Well, I don't know. For me, in Africa, I don't think I'll work, because don't you have something to do?
I mean,
right?
We're not working from home.
Even if you're working from home,
you still sit and work.
So in this context, I don't think in Africa, like.
But then let's talk about menstrual cups. I've heard about it, and a lot of people say they have swapped to that because it's better. But then I want to ask, is it healthy? Is it safe? Can it disappear inside?
So these things, and even tampons, when they first introduced it, it was not like super receptive.
Yeah.
So all of these things, you first need to see anything you want to do in this life, understand
Your body.
Yeah, and then understand. If you know that you don't like anything inside, why would you go and
put something and forget about it, then you come
yes.
But then on a normal day, it is a safe method, right?
Yes, people actually use it, but then there's the technique to put it in, take it out, and all of that. And I feel like most average Nigerians, it's not there. I did a post on it, like maybe sometimes, like some couple of months, and I asked what menstrual products would you use: tissue, sanitary towels, menstrual cup, and all of that. And then majority actually chose sanitary towel, because that's like easy for them. Some people use tampons, but menstrual compass is like Nigerians, they don't have that energy to come and be thinking that. Right.
All right, we have covered 90% of what we have for today. But before we go, let us try to debunk some true, false.
You cannot get pregnant during your period. You technically, what's happening during your period is that the egg has already broken and there's blood shed. So I don't think you can actually get pregnant during your period. If you're saying are you saying that the lady's already on her period and then she's like indulging?
Yes.
Well, you can't technically, because you're ovulating on day 14, and that's when the release of an egg comes. And then what happens on ovulation is, if fertilization does not occur, then you now get your period after 2 weeks.
Okay.
So
the one that is already that is
already
shedding is what that happened
happened
before. So another one's already forming. So you can actually get pregnant. So do not say because of my period I'll be.
No, it doesn't mean that you should go and.
Yes. So always use the cloth when you're indulging. And another thing is that one said that okay. This is going back to period pains.
Okay.
Somebody said that when you're on your period, and the fastest way to relieve pain
I think I know what you want to say.
Yes, so is to engage in coitus, sexual intercourse. Yay or nay?
I was saying nay. It's just like what they call this thing, is it placebo effect? It's just, so technically, when they say your body is releasing natural chemicals,
yes.
the endorphins, they are dose, they call it dose: dopamine, oxytocin, serotonin, and endorphins. So these are feel good chemicals. So if naturally, whether you're period or not, you're in
period at least 5 days. So if you have anything short, it means it's an abnormal period.
So 3 to 5 is fine, right? So when it's getting to like 7, and then it's now you're having to change pads, or doubling pads, and you're bleeding heavily, then you need to start checking it if that's not a secondary cause, like if you're not dealing with a secondary cause.
All right. Like we have talked about today, you said that you have to find out the root cause, but then some people say that PMS is all in your head. That is why when the person says, "Oh my gosh, I cannot do that," I better shake it off, Jerry. You're lying, right? I won't blame people who feel like ladies lie about this, because a lot of ladies do lie about it. They want to feel
dramatic.
Yes, they want to feel among.
Okay.
You're not experiencing anything, no. But you want to feel among. Yes.
May they not
I mean,
experience
why are you? Why can this one get a pass because she says she's feeling this, and this I cannot get a pass from you, so I can do that. I know somebody who did it.
Wow.
Yes. So when you catch somebody in the act, it is very difficult to and then there's no way to find out whether they're really in pain. There's not like a penometer. So is it in the head?
Okay, so it's not all in their head. If you're dealing with PMS, trust me, as in speaking as a person that had to deal with period cramps for over a decade, it's not all in your head, right? And I think that, okay, whilst there are people that can be overly dramatic, maybe like you said, you have a colleague that does not experience it but acts like she does. It doesn't mean that the people that experience it are not experiencing it.
Yes.
For me, my brother will say, you should have gotten used to it. And it's not saying it from a place of anything, but like, you should have gotten used to it. But I'm like, you cannot get used to it. As in, it's like,
you thought died in season 1, it's coming back to season 5.
Oh my god. So you cannot so it's not all in their head. Like, actually, this thing is real.
So when one is actually having the pain actively, is it right? Because if some may say that if you just ignore it, ignore the pain.
Okay.
It's just like when an ostrich buries his head in the sand and says, "If since I cannot see people, they cannot see me."
Okay.
So ignore the pain, and when you ignore it, it's going to go. Works like that?
No, this one is not when a small child falls and you're like, don't carry him. You stop crying, you stop. That's not it. This is not it. You don't ignore it. Matter of fact, it's because they've ignored it. That's why it's most times now turns to something big. So when you see that this is not normal, this has happened this month, next month, it has led to you being absent from school or work, or okay, let's even forget about school. Let's talk about like older ladies. You're not productive. It's taking so much productive time. Like, instead of you to do something throughout the whole day, you're just did not ignore it at all. You should actually, there's this thing I used to say that your body is not a storehouse for pain. It's not a storehouse for pain. See, pain is not your baby. You shouldn't be nursing this thing, right? So it's essential that they don't ignore it, they don't nurse it, and then they speak out.
Okay, any final thoughts before we go?
Okay, so
Continue, that's good.
all right, okay, like I said that the bodies are not storehouses for pain, and they should not ignore it. So if you find out that you're experiencing something that is not your normal, maybe first of all you don't even know what normal is, seek to find out what normal is, right? Seek to find out what normal is, and then when you know that that's not normal, you should voice out. You should look for solutions, because therein lies solutions. But if you don't even know that this is not normal for you, you would not even seek out solution. Then again, you need to know if what you're dealing with is just a primary cause or if it's a secondary cause, because in most cases it's a secondary cause that you need to actually like get proper treatment for.
All right, and you've written something on this, right?
Yes, I wrote a book.
What's the title? Flow freely. Oh, that is why you were. And now you're telling me that free flow in Nigeria is not feasible. What book says flow free? Yeah, you can look out for that by Perfecta or Samwaro MD. All right, thank you very much for joining us today on 98.3 Mainland FM, the sound of Lagos. And put it on this side. Okay, we've talked about menstruation, we've talked about menstrual pain and how it is all, sometimes it's not on the head, but you have to try to treat it some other time when we're calling it.
Right, thank you so much for having me.
Yeah, it's been really fun, really. I don't know, I didn't think I could have so much fun discussing menstruation. Because menstruation, like, can't we skip this? Why would we continue bleeding for how many years until we reach menopause, right? It's crazy, but it's something we have to do. So
Right.
we'll just get used to it.
That's true.
Thank you very much once again. It is 98.3 Mainland FM, the sound of Lagos. Up next is Still on the Matter with Timmy Tames and Alexandra. All you have to do is stay tuned because we have amazing content for you. My name is Lillian, and this is Health Plus. Next week, 10:15, I'll be here. Stay tuned on this dial.